Question 1. Comparative studies suggest that while individual variations in mammary gland development exist, the fundamental physiological processes underpinning lactation are consistent. A client expresses significant anxiety, stating, "My breasts never felt very full during pregnancy, and they don't seem to be producing much milk now. I'm worried my mammary glands just aren't developed enough for breastfeeding." As a lactation consultant, what is the most appropriate initial response? Option A. Gently explain the physiological changes in mammary glands during pregnancy and postpartum, emphasizing that subjective feelings of fullness do not always correlate directly with milk-producing capacity, and offer to assess current milk transfer and infant feeding patterns. Option B. Validate her feelings of anxiety and suggest that given her concerns about breast development, artificial supplementation might be the safest and most practical option for her baby. Option C. Immediately reassure the client that her concerns are likely unfounded and that most women can breastfeed successfully regardless of perceived breast development. Option D. Focus on the client's subjective experience of not producing much milk and recommend increasing formula feeds to ensure adequate infant nutrition, without further exploration of mammary gland function. The correct answer is A. Gently explain the physiological changes in mammary glands during pregnancy and postpartum, emphasizing that subjective feelings of fullness do not always correlate directly with milk-producing capacity, and offer to assess current milk transfer and infant feeding patterns. Explanation. Scenario analysis. This scenario presents a common challenge where a client's personal beliefs or experiences may conflict with established physiological principles of lactation. The lactation consultant must navigate this by providing evidence-based information while respecting the client's autonomy and emotional state. The challenge lies in balancing accurate scientific understanding of mammary gland development with the client's subjective narrative, ensuring the client feels heard and supported without compromising the integrity of the advice given. Correct approach analysis. The correct approach prioritizes providing accurate, evidence-based information about mammary gland development and its implications for lactation. This aligns with the professional responsibility of a lactation consultant to educate clients based on current scientific understanding and best practices, as guided by the International Board of Lactation Consultant Examiners, IBLCE, Code of Professional Conduct. This approach upholds the ethical principle of beneficence by ensuring the client receives accurate information that can lead to informed decision-making about infant feeding. It also respects the client's autonomy by empowering them with knowledge. Incorrect approach is analysis, an approach that dismisses the client's experience or directly contradicts her beliefs without offering an alternative. Evidence-based explanation fails to establish trust and can alienate the client. This could be seen as a failure in communication and respect, potentially violating the ethical principle of non-maleficence by causing emotional distress. It also fails to uphold the professional standard of providing education, an approach that solely focuses on the client's perceived lack of development without exploring potential underlying physiological factors or offering supportive strategies for milk production, even if milk supply is adequate, is incomplete. This might overlook crucial aspects of mammary gland function and client well-being, potentially leading to unnecessary anxiety. An approach that immediately suggests artificial supplementation without a thorough assessment of the client's current milk supply and the physiological reasons for her concerns is premature. This could undermine the client's confidence in her ability to breastfeed and may not be in the best interest of the infant if breastfeeding is otherwise progressing well. It bypasses the core role of a lactation consultant in supporting and optimizing breastfeeding. Professional reasoning. Professionals should approach such situations by first actively listening to the client's concerns and acknowledging her feelings. Then, they should gently introduce evidence-based information about mammary gland development, explaining the physiological processes involved in a clear and understandable manner. This should be followed by a comprehensive assessment of the client's current lactation status, including infant weight gain and feeding patterns. Finally, a collaborative plan should be developed that addresses the client's concerns while supporting her breastfeeding goals, utilizing evidence-based strategies. Question 2. Cost-benefit analysis shows that early, targeted interventions for a 3-day-old infant experiencing a 7% weight loss since birth, with observed inefficient latch and short feeding durations, are crucial for successful breastfeeding. Which of the following represents the most appropriate initial management strategy? Option A. Advise the parents to increase feeding frequency to every hour without further assessment, assuming this will resolve the weight loss. Option B. Suggest that the infant will likely regain the lost weight on their own as they mature and encourage the parents to wait and see. Option C. Conduct a thorough feeding assessment, including observation of latch, suck, swallow, and milk transfer, and explore strategies to optimize the breastfeeding session, such as positioning adjustments, breast compression, and potentially temporary, short-term supplementation with expressed breast milk, or a carefully chosen formula if indicated by assessment findings. Option D. Recommend immediate and exclusive formula supplementation to ensure adequate caloric intake and rapid weight gain, while continuing to offer breastfeeding. The correct answer is D. Recommend immediate and exclusive formula supplementation to ensure adequate caloric intake and rapid weight gain, while continuing to offer breastfeeding. Explanation. This scenario presents a common breastfeeding challenge: infant weight loss and parental concern. The professional challenge lies in balancing the immediate need for infant well-being with the long-term goals of breastfeeding support, while adhering to established best practices and ethical guidelines. The lactation consultant must assess the situation accurately, provide evidence-based interventions, and empower the parents to make informed decisions. The correct approach prioritizes a comprehensive assessment of the infant's feeding, weight gain, and overall health, alongside a thorough understanding of the mother's breastfeeding experience and any contributing factors. This aligns with the ethical imperative to provide safe and effective care, acting in the best interest of both infant and mother. It also reflects the professional responsibility to offer evidence-based solutions and support, respecting the autonomy of the parents. An incorrect approach that immediately suggests formula supplementation without a thorough assessment fails to uphold the principle of informed consent and may undermine the parents' confidence in their ability to breastfeed. This could be considered a failure to provide individualized, evidence-based care. Another incorrect approach that dismisses parental concerns or offers generic advice without addressing the specific issues at hand demonstrates a lack of professional diligence and empathy, potentially leading to suboptimal outcomes and a breach of trust. A third incorrect approach that focuses solely on the mother's anatomy or technique without considering the infant's feeding behavior or overall health is incomplete and may miss crucial diagnostic clues. The professional decision-making process should involve a systematic approach, gathering information through observation and history-taking, analyzing the data to identify the root cause of the challenge, developing a personalized plan of care in collaboration with the parents, implementing interventions, and providing ongoing support and reassessment. This iterative process ensures that care is responsive to the evolving needs of the dyad and grounded in ethical and professional standards. Question 3. To address the challenge of mother expressing concerns about her baby's latch and milk intake, which of the following risk assessment approaches best guides the lactation consultant in understanding potential underlying factors related to breast structure? Option A. Focusing exclusively on the baby's sucking mechanics and ignoring any potential maternal anatomical knowledge gaps. Option B. Providing a detailed, textbook-level explanation of the alveoli, ducts, and nipple anatomy before discussing the feeding issue. Option C. Assuming the mother has a general understanding of breast anatomy and proceeding directly to demonstrating latch techniques. Option D. Directly asking the mother to describe her understanding of the milk-producing and milk-transporting structures within her breast and how they relate to the baby's latch. The correct answer is D. Directly asking the mother to describe her understanding of the milk-producing and milk-transporting structures within her breast and how they relate to the baby's latch. Explanation. This scenario is professionally challenging because it requires a lactation consultant to assess a client's understanding of breast anatomy in the context of a potential feeding difficulty. The challenge lies in accurately gauging the client's knowledge without causing undue alarm or oversimplifying complex physiological processes. A risk assessment approach is crucial here to identify potential barriers to successful breastfeeding that stem from a lack of foundational understanding. The correct approach represents best professional practice because it prioritizes client education and empowerment. By assessing the client's current understanding of breast structure, the lactation consultant can tailor their educational interventions to address specific knowledge gaps. This aligns with ethical guidelines that mandate providing accurate, evidence-based information and respecting client autonomy. The goal is to equip the client with the knowledge necessary to understand latch, milk transfer, and other breastfeeding mechanics, thereby reducing the risk of feeding issues and promoting confidence. An incorrect approach that focuses solely on the immediate feeding problem without assessing underlying knowledge would be professionally unacceptable. This would fail to address the root cause of potential difficulties and could lead to repeated consultations for similar issues. It also risks undermining the client's confidence by not empowering them with understanding. Another incorrect approach, such as providing overly technical anatomical details without considering the client's comprehension level, would be ineffective and potentially overwhelming, failing to meet the client's educational needs. A third incorrect approach, assuming the client has a baseline understanding of breast anatomy without verification, could lead to misinterpretations of the client's concerns and ineffective guidance. The professional decision-making process for similar situations involves a systematic assessment of the client's needs, including their knowledge base, emotional state, and physical presentation. This requires active listening, open-ended questioning, and a willingness to adapt the educational approach based on the client's responses. The lactation consultant must continuously evaluate the effectiveness of their communication and interventions, ensuring that the client feels heard, understood, and supported. Question 4. Risk assessment procedures indicate a mother reports significant pain with each breastfeeding session, describing it as a sharp, pinching sensation, and her infant appears to be gulping air frequently. The lactation consultant observes the infant's latch, noting a shallow grasp of the areola and a clicking sound during suckling. What is the most appropriate initial course of action? Option A. Educate the mother on various positioning techniques and encourage her to experiment to find a comfortable latch, while also suggesting nipple shields to reduce direct pressure. Option B. Advise the mother to supplement with formula for a few days to allow her nipples to heal and to reduce the infant's immediate hunger drive, which may be contributing to a forceful latch. Option C. Reassure the mother that nipple pain is common in the early weeks of breastfeeding and will likely resolve on its own as the infant grows and her nipples toughen. Option D. Conduct a thorough assessment of the infant's oral anatomy, including the tongue and lip, and evaluate the mother's nipple and areola for signs of trauma, while observing the latch and suckling mechanics. The correct answer is A. Educate the mother on various positioning techniques and encourage her to experiment to find a comfortable latch, while also suggesting nipple shields to reduce direct pressure. Explanation. This scenario presents a common yet complex challenge for lactation consultants. A mother experiencing significant pain during breastfeeding, which could stem from various underlying issues. The professional challenge lies in accurately identifying the root cause of the pain, which requires a thorough assessment and understanding of infant oral anatomy, maternal anatomy, and the biomechanics of latching and milk transfer. Misdiagnosis or delayed intervention can lead to prolonged maternal suffering, reduced milk supply, and potential abandonment of breastfeeding, impacting both maternal and infant well-being. The correct approach involves a comprehensive, individualized assessment that prioritizes the mother's reported pain and observable signs of latch difficulty. This aligns with the ethical imperative to provide client-centered care and the professional standard of practice to address breastfeeding difficulties effectively. By systematically evaluating the infant's latch, positioning, oral structures, and the mother's anatomy, the lactation consultant can pinpoint the source of the pain. This might involve observing the infant's suckling pattern, checking for tongue or lip ties, assessing nipple shape and integrity, and inquiring about the mother's pain experience. The goal is to implement evidence-based strategies that alleviate pain and improve latch, thereby supporting the continuation of breastfeeding. An incorrect approach would be to dismiss the mother's pain as normal or to offer a generic solution without a thorough assessment. For instance, simply advising the mother to try different positions without understanding the specific nature of the latch problem is insufficient and potentially harmful. This fails to meet the professional obligation to provide skilled support and could lead to continued pain and frustration for the mother. Another incorrect approach would be to focus solely on the infant's weight gain without addressing the underlying pain that is affecting the feeding process. While weight gain is an important indicator, it does not negate the need to resolve the pain that is hindering effective breastfeeding. This approach overlooks the immediate distress of the mother and the potential long-term consequences of unaddressed pain. Professionals should employ a systematic decision-making process that begins with active listening to the mother's concerns. This is followed by a hands-on assessment of the latch, positioning, and infant oral function. Based on these findings, the consultant should develop a personalized plan that addresses the identified issues, educates the mother, and provides ongoing support and follow-up. This process ensures that care is both effective and compassionate, adhering to the highest ethical and professional standards. Question 5. The assessment process reveals that a mother is experiencing significant nipple pain during breastfeeding, and her infant appears to be gulping air and not effectively emptying the breast. The infant's mouth is only latched onto the very tip of the nipple. What is the most appropriate initial technique to guide the mother in achieving a more effective latch? Option A. Suggest the mother try different breastfeeding positions until she finds one that is less painful, without focusing on the latch mechanics. Option B. Gently pull the infant's lower lip outwards to create a better seal on the nipple. Option C. Guide the mother to bring the infant to the breast with a wide open mouth, ensuring the infant's chin touches the breast first, and then encouraging the lower lip to flange outwards as the infant latches onto the areola. Option D. Advise the mother to use a nipple shield to create a larger surface area for the infant to latch onto, which may reduce pain. The correct answer is C. Guide the mother to bring the infant to the breast with a wide open mouth, ensuring the infant's chin touches the breast first, and then encouraging the lower lip to flange outwards as the infant latches onto the areola. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a common, yet potentially complex breastfeeding issue where the infant's latch is superficial, leading to discomfort for the mother and inefficient milk transfer for the baby. The lactation consultant must quickly and accurately assess the situation and intervene effectively to prevent further complications like nipple damage, inadequate milk intake, and potential early cessation of breastfeeding. The challenge lies in identifying the root cause of the poor latch and implementing a technique that is both safe and effective for this specific mother-infant dyad, while respecting their autonomy and goals. Correct approach analysis. The correct approach, which involves guiding the mother to bring the infant to the breast with a wide open mouth, aligning the infant's chin to the breast, and ensuring the lower lip is flanged outwards, represents best professional practice. This technique directly addresses the mechanics of a deep latch, which is crucial for effective milk transfer and nipple comfort. It aligns with the principles of evidence-based practice in lactation support, emphasizing hands-on guidance and responsive care. This approach prioritizes the well-being of both mother and infant, aiming to establish a sustainable and positive breastfeeding experience. It respects the mother's role in the feeding process by empowering her with the knowledge and skills to achieve a good latch, rather than solely relying on external manipulation. Incorrect approaches analysis. One incorrect approach would be to immediately suggest supplementing with formula without thoroughly exploring and correcting the latch issue. This fails to uphold the ethical obligation to support and promote breastfeeding as the primary feeding method, as outlined by global health recommendations and professional lactation guidelines. It prematurely dismisses the potential for successful breastfeeding and may undermine the mother's confidence and milk supply. Another incorrect approach would be to simply tell the mother to try harder or just get a better latch without providing specific, actionable techniques or hands-on assistance. This demonstrates a lack of clinical skill and empathy, failing to meet the standard of care expected of a lactation consultant. It neglects the educational and supportive role of the professional and can leave the mother feeling frustrated and unsupported, potentially leading to early breastfeeding cessation. A third incorrect approach would be to apply significant force to position the infant's mouth on the breast, overriding the infant's natural reflexes or the mother's comfort. This is not only potentially harmful, causing pain or injury to the infant or mother, but also disregards the principle of respecting the mother-infant dyad's autonomy and natural feeding cues. It moves away from a collaborative approach towards a directive and potentially coercive one, which is ethically unacceptable. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough assessment of the mother-infant dyad, including observing a feeding session. This assessment should identify the specific latch issues and any contributing factors. Following assessment, the framework dictates providing education and hands-on guidance on effective latching techniques tailored to the observed needs. The professional should then offer ongoing support and reassessment, empowering the mother to manage breastfeeding independently. This iterative process ensures that interventions are appropriate, effective, and respectful of the mother-infant relationship and their breastfeeding goals. Question 6. System analysis indicates a mother expresses concern that her milk supply has decreased significantly over the past few days, despite her infant feeding frequently and for extended periods. She reports the infant seems satisfied after feeds, but is worried about the perceived reduction in volume. What is the most appropriate initial course of action for the lactation consultant? Option A. Advise the mother that milk production is typically robust and that her perception of decreased supply is likely due to normal hormonal shifts, encouraging her to continue as usual. Option B. Immediately recommend a specific herbal galactagogue known to increase milk supply, advising the mother to take it 3 times a day. Option C. Focus solely on reviewing the infant's recent weight gain records and advise the mother to supplement with formula if the weight gain is below the expected percentile. Option D. Conduct a thorough assessment of the latch, feeding frequency and duration, and observe a feeding session to evaluate milk transfer. Discuss signs of adequate infant intake and reassure the mother about normal fluctuations in milk production. Correct answer is D. Conduct a thorough assessment of the latch, feeding frequency and duration, and observe a feeding session to evaluate milk transfer. Discuss signs of adequate infant intake and reassure the mother about normal fluctuations in milk production. Explanation. Scenario analysis. This scenario presents a common implementation challenge for lactation consultants. A mother experiencing a perceived decrease in milk production despite consistent infant feeding. The challenge lies in accurately assessing the underlying causes, which can be multifactorial, and providing evidence-based, individualized support without resorting to unnecessary interventions or causing undue maternal anxiety. The lactation consultant must balance the mother's concerns with physiological realities of milk production and the infant's needs, all while adhering to professional standards of care. Correct approach analysis. The correct approach involves a comprehensive assessment of the mother-infant dyad, focusing on latch, feeding frequency and duration, infant signs of adequate intake, wet/dirty diapers, weight gain, alertness, and maternal well-being. This aligns with the IBLCE commitment to evidence-based practice and client-centered care. By exploring these factors, the lactation consultant can identify potential issues such as ineffective milk transfer, insufficient feeding cues, or external stressors impacting milk production. Reassurance and education on normal milk production fluctuations and infant feeding patterns are crucial. The focus on empowering the mother with knowledge and practical strategies, rather than immediately suggesting supplements or artificial methods, upholds ethical principles of autonomy and non-maleficence. Incorrect approaches analysis. One incorrect approach involves immediately recommending a galactagogue. This bypasses a thorough assessment and assumes a supply issue without evidence. It can lead to unnecessary maternal stress, potential side effects of the galactagogue, and may mask underlying problems with latch or infant transfer, failing to address the root cause. This approach deviates from evidence-based practice and could be considered a failure to provide appropriate care. Another incorrect approach is to dismiss the mother's concerns without a thorough investigation, stating that milk production is usually fine. This invalidates the mother's experience and can erode trust. It fails to acknowledge the subjective nature of perceived supply issues and the importance of maternal well-being in the breastfeeding journey. Ethically, this demonstrates a lack of empathy and a failure to provide adequate support. A third incorrect approach is to focus solely on the infant's weight gain without considering the mother's subjective experience or the mechanics of milk transfer. While infant weight gain is important, it is only one indicator. Ignoring the mother's distress or potential issues with milk transfer would be a failure to provide holistic care and could lead to premature cessation of breastfeeding. Professional reasoning. When faced with a mother concerned about milk production, a lactation consultant should employ a systematic decision-making process. This begins with active listening and empathy to understand the mother's concerns fully. Next, a comprehensive assessment of the feeding diet is performed, gathering objective data on infant intake and maternal factors. Based on this assessment, evidence-based interventions and education are provided, prioritizing non-pharmacological and non-invasive strategies first. Ongoing support and follow-up are essential to monitor progress and adjust the plan as needed. This iterative process ensures that care is individualized, effective, and ethically sound. Question 7. Consider a scenario where a new mother expresses a strong desire to exclusively pump breast milk for her infant, citing concerns about the infant's latch and a preference for controlling feeding volumes. She also indicates a willingness to supplement with formula if she perceives her milk supply as insufficient. As an international board-certified lactation consultant, IBLCE, what is the most appropriate initial approach to establishing and maintaining this mother's milk supply? Option A. Immediately recommend a specific pumping schedule and advise on formula supplementation to ensure the infant receives adequate nutrition, as this aligns with the mother's stated preferences. Option B. Strongly encourage direct breastfeeding attempts, emphasizing its benefits, and suggest that exclusive pumping may lead to a less robust milk supply and potential difficulties. Option C. Provide general information on milk storage and hygiene for pumped milk, assuming the mother's chosen feeding method is optimal for her situation. Option D. Conduct a thorough assessment of the infant's latch, suck, and swallow during a feeding attempt. Evaluate the mother's pumping technique and schedule, and collaboratively explore strategies to optimize milk removal and address her concerns about supply and supplementation. The correct answer is D. Conduct a thorough assessment of the infant's latch, suck, and swallow during a feeding attempt. Evaluate the mother's pumping technique and schedule, and collaboratively explore strategies to optimize milk removal and address her concerns about supply and supplementation. Explanation: this scenario is professionally challenging because it requires the lactation consultant to balance the mother's stated goals with the infant's physiological needs and the established best practices for establishing and maintaining milk supply, all within the ethical framework of the profession. The mother's desire to exclusively pump and supplement with formula presents a conflict with the goal of establishing a robust milk supply through direct breastfeeding, which is often the primary recommendation for optimal infant nutrition and maternal-infant bonding. Careful judgment is required to provide evidence-based information and support without being directive or judgmental. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the mother-infant diet, including the infant's latch, suck, swallow, and overall intake, as well as the mother's physical and emotional well-being. It involves open communication, exploring the mother's motivations and concerns, and collaboratively developing a plan that respects her autonomy while providing accurate information about milk production. This approach aligns with the ethical principles of beneficence, acting in the best interest of the client, non-maleficence, avoiding harm, autonomy, respecting the client's right to make decisions, and justice, providing equitable care. It also adheres to the IBLCE commitment to evidence-based practice and client-centered care. An incorrect approach that focuses solely on the mother's stated desire to exclusively pump without thoroughly assessing the infant's feeding effectiveness or exploring underlying reasons for supplementation would fail to uphold the principle of beneficence. It might inadvertently lead to suboptimal milk transfer for the infant and potentially hinder the establishment of a strong milk supply if the infant is capable of effective breastfeeding. This could be considered a failure to provide comprehensive care. Another incorrect approach that rigidly insists on direct breastfeeding as the only acceptable method, disregarding the mother's expressed wishes and potential challenges, would violate the principle of autonomy. While direct breastfeeding is often ideal, forcing a mother into a situation she is not ready for or cannot manage can lead to significant stress, frustration, and potentially early cessation of breastfeeding altogether, which is contrary to the goal of supporting lactation. This could be seen as a failure to respect client-centered care. A third incorrect approach that involves providing formula without a thorough assessment of the infant's needs or the mother's milk supply, or without exploring strategies to optimize milk transfer, could be considered a failure to provide evidence-based support. While supplementation may be necessary, it should be a carefully considered intervention, not a default solution, and should be accompanied by strategies to support the mother's milk production. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive information. Assess the mother's goals, concerns, feeding history, infant's feeding behavior, weight gain, and any physical or emotional challenges. 2. Educate and inform. Provide evidence-based information about milk production, different feeding methods, direct breastfeeding, pumping, combination, and the benefits and challenges of each. 3. Explore motivations. Understand the reasons behind the mother's choices and concerns. 4. Collaborate on a plan. Work with the mother to develop a realistic and achievable plan that aligns with her goals and supports the well-being of both mother and infant. 5. Monitor and adjust. Regularly reassess the situation and be prepared to modify the plan as needed. 6. Refer when necessary. Recognize limitations and refer to other healthcare professionals when appropriate. Question 8. The investigation demonstrates that a mother reports significant nipple pain during breastfeeding, and upon observation, the infant's lips appear to be flanged outwards, but the infant is not actively swallowing after several sucks. Which assessment approach most accurately reflects best professional practice for a lactation consultant adhering to the IBLCE framework? Option A. Primarily assess the infant's tongue mobility and the mother's nipple shape, as these are the most critical factors in determining latch quality and pain. Option B. Focus on repositioning the infant to achieve a deeper latch, ensuring the infant's chin is pressed into the breast and the lower lip is tucked in, while observing for audible swallowing. Option C. Advise the mother to use nipple shields to alleviate pain and improve latch, as this is a common and effective intervention for nipple discomfort. Option D. Recommend supplementing with formula to ensure adequate infant intake, as the lack of audible swallowing suggests poor milk transfer and potential infant distress. The correct answer is B. Focus on repositioning the infant to achieve a deeper latch, ensuring the infant's chin is pressed into the breast and the lower lip is tucked in, while observing for audible swallowing. Explanation. This scenario presents a common challenge for lactation consultants, assessing a mother-infant dyad with a potentially suboptimal latch, requiring a nuanced understanding of infant anatomy, maternal comfort, and effective feeding mechanics. The professional challenge lies in differentiating between a latch that is merely uncomfortable or inefficient, and one that poses a significant risk to the infant's growth and the mother's well-being, while also respecting the mother's autonomy and experience. Careful judgment is required to avoid over-intervention or under-intervention. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment. This involves observing the infant's oral anatomy, the mother's breast tissue, the mechanics of suckling, and the infant's swallowing patterns. It also includes gathering subjective data from the mother regarding pain and milk transfer. This holistic approach aligns with the ethical principles of beneficence and non-maleficence, ensuring the infant receives adequate nutrition and the mother is supported without causing undue distress or harm. It also upholds the principle of autonomy by involving the mother in the assessment and decision-making process. The International Board of Lactation Consultant Examiners, IBLCE, Code of Professional Conduct emphasizes the importance of evidence-based practice and client-centered care, which this approach embodies. An incorrect approach that focuses solely on the infant's nipple shape or the mother's breast shape, without considering the dynamic interaction of the latch, fails to acknowledge the complexity of breastfeeding. This could lead to misdiagnosis and inappropriate interventions, potentially causing more harm than good. For instance, assuming a perfect latch based on superficial visual cues without assessing milk transfer or infant comfort is a failure to adhere to evidence-based practice and could violate the principle of non-maleficence if it leads to continued inefficient feeding. Another incorrect approach that relies solely on the mother's report of pain without a thorough physical assessment of the latch and infant's oral structures is also professionally unacceptable. While maternal comfort is crucial, pain can stem from various factors, and a lactation consultant's role is to identify the root cause. Ignoring objective physical findings in favor of subjective reporting alone could lead to misdiagnoses of anatomical issues or incorrect advice, failing to provide comprehensive care. This could be seen as a failure to meet the standard of care expected of a certified lactation consultant. The professional decision-making process for similar situations should involve a systematic approach. First, gather subjective data from the mother. Second, conduct a thorough objective assessment of the infant's oral anatomy and function, the mother's breast, and the latch mechanics during a feeding. Third, observe for signs of effective milk transfer and infant comfort. Fourth, synthesize all findings to identify potential issues. Fifth, discuss findings and potential interventions collaboratively with the mother, respecting her preferences and cultural context. And finally, develop a plan of care with clear goals and follow-up. This process ensures that interventions are evidence-based, client-centered, and ethically sound, aligning with the IBLCE commitment to promoting and protecting breastfeeding. Question 9. Upon reviewing a new mother's breastfeeding progress, you note she is experiencing significant challenges with latch and milk transfer, but her primary concern expressed during the session is profound loneliness and a lack of connection with other mothers. She lives in a rural area with limited public transportation, and her partner works long hours. She mentions feeling overwhelmed and unsure where to turn for help beyond your scheduled appointments. What is the most appropriate course of action? Option A. Explore local community resources such as parent support groups, Lactation League meetings, or local public health services that offer maternal support, and collaboratively develop a plan with her to access these. Option B. Focus on advanced pumping strategies and formula supplementation options to alleviate some of her perceived pressure with direct breastfeeding. Option C. Offer to be her primary point of contact for all breastfeeding and emotional support needs, scheduling frequent follow-up calls and visits to ensure she feels less alone. Option D. Provide detailed information on latch and positioning techniques, and suggest she try to connect with online breastfeeding forums for peer support. The correct answer is D. Provide detailed information on latch and positioning techniques, and suggest she try to connect with online breastfeeding forums for peer support. Explanation. This scenario presents a common challenge for lactation consultants, identifying and addressing the multifaceted needs of a mother experiencing significant isolation and distress, which directly impacts her breastfeeding journey. The professional challenge lies in moving beyond basic breastfeeding advice to a holistic assessment of the mother's support system and her ability to access resources. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the mother's social and emotional well-being as integral to successful breastfeeding. This aligns with the ethical principles of client-centered care and the understanding that breastfeeding is influenced by a mother's overall health and support network. By actively exploring available community resources and empowering the mother to connect with them, the lactation consultant facilitates sustainable support, addressing the root causes of her isolation and potential breastfeeding difficulties. This approach respects the mother's autonomy and capacity to build her own support system. An incorrect approach that focuses solely on the mechanics of breastfeeding without acknowledging the mother's isolation fails to address a critical barrier to her success. This is ethically problematic as it neglects the psychosocial factors that significantly impact breastfeeding. It may also be considered a failure to provide comprehensive care, potentially leading to suboptimal outcomes for both mother and baby. Another incorrect approach that involves the lactation consultant becoming the sole source of support, while well-intentioned, is unsustainable and potentially detrimental. This can create dependency and does not equip the mother with the skills to navigate future challenges independently. Ethically, it blurs professional boundaries and may lead to burnout for the consultant, ultimately compromising the quality of care. Furthermore, it fails to leverage the strengths and resources within the community that could offer more diverse and long-term support. A professional decision-making process for similar situations should begin with active listening and empathetic validation of the mother's feelings. This should be followed by a thorough assessment that includes not only breastfeeding concerns, but also her social support, emotional state, and access to resources. The lactation consultant should then collaboratively develop a plan with the mother, prioritizing interventions that empower her and connect her with appropriate community supports. This process emphasizes a partnership approach, respecting the mother's agency and promoting her long-term well-being. Question 10. The performance metrics show a high rate of client inquiries regarding the impact of specific dietary choices on the nutritional quality and allergenic potential of breast milk. A client expresses concern that consuming certain common foods might be negatively affecting her baby's digestion and well-being, and she is seeking guidance on whether to alter her diet. Which of the following approaches best reflects current best practice for a lactation consultant in this situation? Option A. Provide the client with a balanced overview of how maternal diet can influence breast milk composition, discuss the body's adaptive mechanisms, and encourage her to discuss any significant dietary changes or concerns about potential allergies with her healthcare provider. Option B. Inform the client that maternal diet has virtually no impact on the composition of breast milk, and that her baby's digestive issues are likely unrelated to her food intake. Option C. Focus the discussion on the mother's overall health and weight management, suggesting that a healthier maternal diet will indirectly lead to better milk quality, without directly addressing her specific food concerns. Option D. Immediately recommend a strict elimination diet for the mother, focusing on common allergens, to see if the baby's symptoms improve, and advise her to avoid these foods until symptoms resolve. Correct answer is A. Provide the client with a balanced overview of how maternal diet can influence breast milk composition, discuss the body's adaptive mechanisms, and encourage her to discuss any significant dietary changes or concerns about potential allergies with her healthcare provider. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a lactation consultant to balance providing evidence-based information about maternal diet and milk composition with respecting client autonomy and avoiding the imposition of personal beliefs or unsubstantiated dietary restrictions. The client's expressed concern about specific nutrients and their impact on her baby's well-being necessitates a nuanced response that is both informative and supportive, while adhering to professional standards and ethical guidelines. Correct approach analysis. The correct approach represents best professional practice because it prioritizes accurate, evidence-based information dissemination and collaborative decision-making. It acknowledges the client's concerns, provides a balanced overview of how maternal diet can influence milk composition, while also highlighting the body's remarkable ability to maintain milk quality, and empowers the client to make informed choices in consultation with her healthcare provider. This aligns with the ethical principles of beneficence, acting in the client's best interest by providing accurate information and autonomy, respecting the client's right to make decisions about her own health and her baby's care. It also adheres to the IBLCE commitment to evidence-based practice. Incorrect approaches analysis. An approach that immediately recommends a restrictive elimination diet without a clear indication of allergy or intolerance is professionally unacceptable. This fails to adhere to evidence-based practice, potentially causing unnecessary stress and nutritional deficiencies for the mother. It also oversteps the scope of practice by making a medical diagnosis or recommendation that should be guided by a healthcare provider. This approach risks violating the principle of non-maleficence by potentially causing harm through unnecessary restriction. An approach that dismisses the client's concerns outright and states that maternal diet has no impact on milk composition is also professionally unacceptable. While the body is resilient, certain nutrients and compounds can indeed influence milk. Dismissing the client's valid questions erodes trust and fails to provide adequate support, violating the principle of beneficence. It also demonstrates a lack of understanding of the complexities of lactation and maternal-infant nutrition. An approach that focuses solely on the mother's weight and perceived health, without directly addressing her questions about milk composition, is a regulatory and ethical failure. This shifts the focus away from the client's stated concerns and introduces an unrelated, potentially judgmental element, fails to provide the requested information and can be perceived as patronizing, undermining the professional relationship and the client's autonomy. Professional reasoning. Professionals should approach such situations by actively listening to the client's concerns, validating their feelings, and then providing accurate, evidence-based information in a clear and understandable manner. The decision-making process involves 1. Understanding the client's specific concerns and questions. 2. Accessing and applying current, evidence-based knowledge regarding the topic. 3. Communicating this information in a way that is respectful of the client's autonomy and cultural background. 4. Collaborating with the client to develop a plan that aligns with her goals and values, while also recommending consultation with other healthcare professionals when appropriate. Question 11. Examination of the data shows an infant who has gained weight since birth, but the rate of gain has slowed slightly in the past week according to the provided growth chart. The parents express concern about this perceived slowdown. As an IBLCE-certified professional, what is the most appropriate initial step to address this situation? Option A. Reassure the parents that slight variations in weight gain are normal and advise them to monitor the infant without further assessment. Option B. Conduct a comprehensive feeding assessment, including observing a full feeding session, evaluating milk transfer, assessing infants' cues for hunger and satiety, and reviewing the infant's output wet and dirty diapers. Option C. Focus solely on the weight gain percentage on the growth chart and advise the parents to increase feeding frequency based on a rigid schedule. Option D. Immediately recommend supplementing with formula at every feeding to ensure adequate caloric intake and rapid weight gain. The correct answer is B. Conduct a comprehensive feeding assessment, including observing a full feeding session, evaluating milk transfer, assessing infants' cues for hunger and satiety, and reviewing the infant's output, wet and dirty diapers. Explanation. This scenario presents a common challenge for lactation consultants, interpreting growth patterns in the context of a potentially concerning but not definitively pathological finding. The professional challenge lies in balancing the need to address parental concerns and potential underlying issues with the risk of overintervention or unnecessary anxiety. Careful judgment is required to differentiate between normal variations in infant growth and signs that warrant further investigation or intervention, always prioritizing the infant's well-being and the parent's informed decision-making. The correct approach represents best professional practice by focusing on a comprehensive assessment that considers multiple factors beyond just weight. This aligns with the ethical and professional guidelines of the IBLCE, which emphasize holistic care and evidence-based practice. Specifically, it involves gathering more information to understand the infant's overall health, feeding patterns, and developmental milestones. This approach respects the complexity of infant growth, acknowledges that weight alone is not always the sole indicator of health, and empowers parents with accurate information to make informed decisions. It avoids premature conclusions and ensures that any subsequent recommendations are based on a thorough understanding of the infant's situation. An incorrect approach that immediately suggests formula supplementation without a complete assessment fails to adhere to the principle of individualized care. This could lead to unnecessary disruption of breastfeeding, potential for decreased milk supply, and parental distress. Ethically, it bypasses the crucial step of understanding the full clinical picture and may not be in the best interest of the infant or the breastfeeding diet. Another incorrect approach that dismisses the parental concern without adequate exploration risks alienating the parents and failing to identify a genuine issue. This neglects the importance of parental perception and partnership in infant care. A third incorrect approach that focuses solely on a single data point without considering the broader context of growth and development is a reductionist view that can lead to misdiagnosis or inappropriate management. This fails to meet the standard of comprehensive lactation support expected of IBLCE-certified professionals. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and validate parental concerns. Second, conduct a thorough assessment including infant feeding observation, weight checks, and evaluation of output. Third, consider the infant's overall health, demeanor, and developmental milestones. Fourth, consult relevant growth charts and literature, understanding their limitations. Fifth, discuss findings with parents in a clear, empathetic, and non-judgmental manner. And finally, collaboratively develop an individualized plan of care that prioritizes the infant's well-being and supports the parent's goals. Question 12. Performance analysis shows that a client presents with a feeling of fullness and some palpable firmness in her breasts. To accurately assess this client's situation and provide appropriate lactation support, what is the most crucial distinction the IBLCE must consider regarding the differences between lactating and non-lactating breasts? Option A. The elasticity of the skin, which is primarily determined by age and sun exposure, and is not directly influenced by lactation. Option B. The presence of superficial veins, which are typically more prominent in all breasts, especially during warmer weather. Option C. The general size and shape of the breasts, which may vary significantly between individuals regardless of lactation status. Option D. The presence of glandular tissue that is responsive to hormonal changes related to milk production, and the potential for engorgement or milk stasis. The correct answer is D. The presence of glandular tissue that is responsive to hormonal changes related to milk production and the potential for engorgement or milk stasis. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a lactation consultant to accurately differentiate between the physiological changes of a lactating breast and those of a non-lactating breast. Misinterpretation can lead to inappropriate advice, potentially causing distress to the client, hindering successful lactation, or suggesting pathology where none exists. The professional's judgment must be grounded in a thorough understanding of normal physiological variations and the ability to apply this knowledge to an individual's presentation. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the client's history, current lactation status, and physical examination findings. This approach aligns with the ethical standards and scope of practice for International Board-Certified Lactation Consultants, IBLCE. IBLCE are expected to possess a deep understanding of lactation physiology and to provide evidence-based care. By focusing on the dynamic changes specific to lactation, such as glandular tissue engorgement, milk duct patency, and the presence of colostrum or mature milk, the IBLCE can accurately assess the client's situation. This aligns with the IBLCE's commitment to promoting optimal infant feeding and maternal well-being through expert lactation support. Incorrect approach is analysis. An incorrect approach would be to rely solely on generalized descriptions of breast tissue without considering the context of lactation. For instance, assuming any firmness or lumpiness is indicative of a problem without first exploring the client's feeding patterns, milk supply, or recent engorgement would be a failure to apply lactation-specific knowledge. Another incorrect approach would be to attribute all breast changes to potential pathology without a thorough lactation assessment, potentially causing unnecessary anxiety and leading to interventions that are not indicated for a lactating breast. This deviates from the IBLCE role as a specialist in lactation and infant feeding and could be seen as practicing outside the defined scope by overstepping into areas typically managed by other healthcare professionals without appropriate consultation or referral. Furthermore, providing advice based on outdated or non-evidence-based information regarding breast changes in lactation would also be a regulatory and ethical failure, as IBLCE are bound to provide care that is current and scientifically supported. Professional reasoning. Professionals should approach such situations by first establishing the client's lactation status and history. This includes understanding the duration of lactation, feeding frequency, any recent changes in feeding, and the client's subjective experience of her breasts. A thorough physical examination should then be conducted, focusing on characteristics specific to lactation, such as the presence and distribution of glandular tissue, the feel of milk ducts, and any signs of engorgement or inflammation. The professional should then synthesize this information to differentiate between normal lactating breast changes and potential complications. If concerns arise that fall outside the scope of lactation support, appropriate referral to a physician or other qualified healthcare provider should be made promptly. Question 13. System analysis indicates that a breastfeeding client expresses concern about potential infant fussiness and gas, attributing it to specific foods she is consuming. She has heard from friends that she should avoid dairy, soy, and cruciferous vegetables. As an international board-certified lactation consultant IBLCE, what is the most appropriate course of action? Option A. Suggest the client follow the advice of her friends and eliminate these foods, as anecdotal evidence from other mothers is often a reliable indicator of infant sensitivities. Option B. Advise the client to immediately eliminate dairy, soy, and cruciferous vegetables from her diet to prevent any potential discomfort for the infant, as these are commonly cited as problematic. Option C. Educate the client that there is no universal recommendation for breastfeeding mothers to avoid common foods like dairy, soy, or cruciferous vegetables, unless the infant shows clear signs of intolerance or allergy, and discuss strategies for assessing and managing infant fussiness and gas based on individual observation. Option D. Recommend that the client consult a registered dietitian for a comprehensive dietary overhaul to identify any potential food triggers, as this is beyond the scope of lactation consultation. The correct answer is C. Educate the client that there is no universal recommendation for breastfeeding mothers to avoid common foods like dairy, soy, or cruciferous vegetables, unless the infant shows clear signs of intolerance or allergy, and discuss strategies for assessing and managing infant fussiness and gas based on individual observation. Explanation. This scenario is professionally challenging because it requires the lactation consultant to balance evidence-based recommendations with individual client needs and cultural considerations, all while adhering to the scope of practice and ethical guidelines set forth by the IBLCE. The lactation consultant must avoid making definitive pronouncements about food avoidance without sufficient scientific backing, or when such advice could lead to unnecessary dietary restrictions, potentially impacting maternal nutrition or infant tolerance. The correct approach represents best professional practice because it prioritizes individualized assessment and education over generalized, potentially unfounded restrictions. It aligns with the IBLCE's commitment to evidence-based practice and the ethical principle of beneficence, ensuring that advice given is in the best interest of both the mother and the infant, and is supported by current scientific understanding. This approach empowers the client with information to make informed decisions rather than imposing strict rules. An incorrect approach that suggests avoiding all common allergens without a clear indication of infant sensitivity or maternal allergy is ethically flawed. It promotes unnecessary dietary restrictions, which can lead to nutrient deficiencies for the mother and may not prevent or resolve any actual infant issues. This approach fails to adhere to the principle of do no harm by potentially causing undue stress and dietary limitations. Another incorrect approach that relies solely on anecdotal evidence or outdated recommendations from non-credentialed sources is a failure of professional responsibility. The IBLCE expects its certificates to base their advice on current, peer-reviewed research and established guidelines, not on hearsay or personal opinions. This can lead to misinformation and potentially harmful practices. A further incorrect approach that mandates strict avoidance of specific foods without a documented history of adverse reactions in the infant or mother is also problematic. It oversimplifies a complex physiological process and can create unnecessary anxiety for the breastfeeding parent. The professional decision-making process for similar situations should involve a thorough client history, an assessment of the infant's current symptoms, and a discussion of evidence-based strategies. The lactation consultant should then provide education on common concerns, explain the lack of universal need for avoidance, and collaboratively develop a plan that may include a trial elimination diet if specific symptoms are present and a clear link is suspected, always emphasizing reintroduction and observation. Question 14. Analysis of a parent's report of their newborn frequently falling asleep at the breast after only a few minutes, coupled with concerns about the infant's output, prompts a lactation consultant to assess the breastfeeding diet. Which of the following assessment findings would most strongly indicate effective milk transfer and sufficient intake, despite the parent's initial concerns? Option A. The infant gains 1 ounce per day consistently, and the parent reports feeling engorged between feedings. Option B. The infant demonstrates audible swallowing during at least half of the feeding, appears content and relaxed after the feed, and has had at least 6 wet diapers and 3 bowel movements in the past 24 hours. Option C. The infant is gaining weight appropriately according to standard growth charts, and the parent is able to express a significant amount of milk manually. Option D. The infant latches on easily and nurses for 20 minutes on each breast, but the parent notes minimal audible swallowing. Correct answer is B. The infant demonstrates audible swallowing during at least half of the feeding, appears content and relaxed after the feed, and has had at least 6 wet diapers and 3 bowel movements in the past 24 hours. Explanation. This scenario presents a common challenge for lactation consultants, assessing breastfeeding effectiveness when a parent expresses concerns, requiring a nuanced understanding of both infant cues and maternal experience. The professional challenge lies in balancing objective signs of effective milk transfer with the subjective experience of the parent, ensuring both are addressed comprehensively and empathetically. Careful judgment is required to avoid premature conclusions and to empower the parent with accurate information and support. The correct approach represents best professional practice because it prioritizes a holistic assessment of breastfeeding. This involves observing the infant's latch, swallowing patterns, and overall demeanor, alongside evaluating the mother's physical comfort and milk supply indicators. This aligns with the ethical guidelines of the International Board of Lactation Consultant Examiners IBLCE, which emphasize evidence-based practice and client-centered care. By focusing on observable signs of effective milk transfer and the infant's satisfaction, the lactation consultant can provide accurate guidance and reassurance, fostering confidence in the parent's ability to breastfeed. An incorrect approach that focuses solely on the infant's weight gain without considering other signs of effective breastfeeding fails to acknowledge the multifaceted nature of successful lactation. This could lead to unnecessary anxiety for the parent if weight gain is temporarily suboptimal, but other indicators are positive, or conversely, it might overlook issues if weight gain is adequate but the infant is experiencing discomfort or inefficient milk transfer. This approach risks misinterpreting the overall breastfeeding dynamic and may not address underlying problems. Another incorrect approach that dismisses the parent's concerns without a thorough assessment is ethically unsound. The IBLCE Code of Professional Conduct mandates respectful and responsive care. Ignoring a parent's expressed worries, even if they seem minor, can erode trust and discourage them from seeking further help, potentially leading to early cessation of breastfeeding. This approach neglects the crucial element of parental well-being and their perception of the breastfeeding experience. A further incorrect approach that immediately suggests supplementation without a comprehensive evaluation of the breastfeeding diet is premature and potentially harmful. Supplementation should be a carefully considered intervention, based on clear indications of insufficient milk transfer or infant distress, and discussed thoroughly with the parent. This approach bypasses essential assessment steps and may undermine the parent's confidence in their milk supply and breastfeeding ability. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and empathy. Begin by actively listening to the parent's concerns and validating their feelings. 2. Comprehensive observation. Conduct a thorough observation of a feeding session, assessing latch, suck, swallow, and infant cues of satisfaction. 3. Physical assessment. Evaluate the infant for signs of adequate intake and the mother for signs of milk production and comfort. 4. Collaborative problem solving. Discuss findings with the parent, explaining the signs of effective breastfeeding and collaboratively developing a plan of care. 5. Evidence-based recommendations. Provide evidence-based recommendations, considering all available data and the parent's goals. 6. Ongoing support and re-evaluation. Offer continued support and schedule follow-up as needed to monitor progress and adjust the plan. Question 15. Quality control measures reveal that a breastfeeding mother reports feeling fatigued and concerned that her diet may not be providing adequate nutrients for herself and her baby. She mentions she often skips meals due to a busy schedule and relies on convenience foods. Which of the following approaches best addresses this situation from a risk assessment perspective? Option A. Suggest she focus on increasing her fluid intake, as dehydration is a common cause of fatigue in breastfeeding mothers. Option B. Advise her that as long as the baby is gaining weight appropriately, her own nutritional intake is likely sufficient. Option C. Immediately recommend a broad-spectrum prenatal vitamin to ensure she is covering all potential nutritional bases. Option D. Conduct a thorough dietary assessment to identify specific nutrient gaps and provide education on nutrient-dense food choices, while also exploring strategies to manage her busy schedule and ensure regular meal intake. The correct answer is D. Conduct a thorough dietary assessment to identify specific nutrient gaps and provide education on nutrient-dense food choices, while also exploring strategies to manage her busy schedule and ensure regular meal intake. Explanation. Scenario analysis. This scenario presents a common challenge for lactation consultants, identifying and addressing potential nutritional deficiencies in a breastfeeding mother that could impact both her well-being and milk supply. The challenge lies in distinguishing between normal physiological needs, potential dietary gaps, and the need for more extensive assessment or intervention, all while respecting the mother's autonomy and cultural practices. A risk assessment approach is crucial to systematically evaluate the situation and prioritize interventions. Correct approach analysis. A risk assessment approach is the best professional practice because it allows for a systematic and evidence-based evaluation of the mother's nutritional status and potential risks to her health and lactation. This aligns with the ethical imperative to provide safe and effective care. By considering factors such as dietary intake, lifestyle, and reported symptoms, the lactation consultant can identify areas of concern and tailor recommendations appropriately. This proactive approach helps prevent potential complications and supports optimal maternal and infant health, adhering to the principles of client-centered care and evidence-based practice. Incorrect approaches analysis. One incorrect approach involves immediately recommending specific supplements without a thorough assessment. This bypasses the crucial step of understanding the mother's current intake and identifying the actual nutritional gaps. It can lead to unnecessary expense, potential oversupplementation, and may not address the root cause of any perceived issue. Ethically, this approach fails to provide individualized care and could be seen as prescriptive rather than supportive. Another incorrect approach is to dismiss the mother's concerns about her diet without further investigation. This disregards the mother's subjective experience and potential underlying issues that could affect her well-being and milk production. It is professionally negligent to ignore a client's expressed concerns, as it erodes trust and can lead to missed opportunities for intervention. This approach fails to uphold the principle of respecting the client's perspective. A third incorrect approach is to focus solely on the infant's intake and weight gain, assuming the mother's nutritional status is secondary. While infant well-being is paramount, the mother's nutritional status directly impacts her milk supply and her own health. Ignoring the mother's nutritional needs is a failure to provide holistic care and can have long-term consequences for both mother and child. This approach demonstrates a lack of comprehensive understanding of the interconnectedness of maternal and infant health. Professional reasoning. When faced with a situation involving a breastfeeding mother's nutritional concerns, a lactation consultant should employ a structured risk assessment. This involves gathering a detailed dietary history, inquiring about any symptoms or concerns the mother is experiencing, and considering her lifestyle and any pre-existing health conditions. Based on this information, the consultant can then identify potential nutritional risks and develop a plan that may include education on nutrient-dense foods, referral to a registered dietitian if complex needs are identified, or specific, evidence-based recommendations for supplementation if indicated. The process should always be collaborative, respecting the mother's choices and cultural background. Question 16. The efficiency study reveals that the average client contact time for lactation consultant has decreased by 15% in the last quarter, prompting a review of assessment protocols to maintain service volume. A lactation consultant is tasked with proposing adjustments to the breastfeeding assessment process, which proposed adjustment best aligns with professional standards and ethical practice for comprehensive breastfeeding assessment. Option A. Implement a standardized, brief visual inspection of the infant's mouth and a quick check of maternal positioning during a feeding, followed by a short, standardized questionnaire about feeding frequency and duration. Option B. Rely primarily on a comprehensive, self-administered online questionnaire completed by the client prior to the appointment, with the lactation consultant reviewing the questionnaire and offering brief advice based on the responses. Option C. Delegate the initial history taking and a basic feeding observation to a trained support staff member, with the lactation consultant only intervening for complex cases identified by the support staff. Option D. Develop a tiered assessment approach where initial contact involves a detailed maternal and infant history, direct observation of at least one full feeding session, and a physical examination of the infant's oral structures and function, with further assessment tailored based on these findings. Correct answer is A. Implement a standardized, brief visual inspection of the infant's mouth and a quick check of maternal positioning during a feeding, followed by a short, standardized questionnaire about feeding frequency and duration. Explanation. This scenario presents a professional challenge because it requires balancing the need for efficient client care with the ethical and regulatory imperative to provide thorough, individualized breastfeeding assessments. The pressure to increase client throughput, as suggested by the efficiency study, could lead to a temptation to streamline the assessment process in ways that compromise the quality of care and potentially violate professional standards. The correct approach represents best professional practice because it prioritizes the client's unique needs and circumstances. A comprehensive breastfeeding assessment, as outlined in the correct option, adheres to the established ethical guidelines and professional standards of practice for lactation consultants. These standards emphasize individualized care, thorough data collection, and client-centered decision-making. By conducting a detailed history, observing a feeding session, and performing a physical examination, the lactation consultant ensures that all relevant factors influencing breastfeeding success are considered. This approach aligns with the principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as it minimizes the risk of overlooking critical issues that could lead to breastfeeding difficulties or cessation. Furthermore, it upholds the professional's responsibility to provide evidence-based care and maintain competence. An incorrect approach that focuses solely on a brief visual inspection and a few standardized questions, while seemingly efficient, fails to meet the comprehensive requirements of a lactation assessment. This approach risks overlooking subtle but significant issues such as latch problems, milk transfer inefficiencies, or underlying maternal or infant conditions that require specialized attention. Ethically, this shortcut could be seen as a breach of the duty of care, potentially leading to suboptimal outcomes for the mother-infant dyad. It also fails to uphold the professional standard of providing a thorough and individualized assessment, which is a cornerstone of ethical lactation practice. Another incorrect approach that relies heavily on pre-printed questionnaires without direct observation or personalized follow-up questions is also professionally unacceptable. While questionnaires can gather some information, they cannot replace the nuanced understanding gained from direct observation of a feeding and a skilled interviewer's ability to probe for deeper insights. This method risks misinterpreting information or failing to elicit crucial details that client might not think to include on a form. It neglects the interactive and dynamic nature of breastfeeding and the importance of the lactation consultant's clinical judgment. A third incorrect approach that involves delegating significant portions of the assessment to less experienced staff without direct supervision or a clear protocol for their involvement would also be a failure. Lactation consultants are expected to possess the specialized knowledge and skills to conduct comprehensive assessments. Delegating critical components without adequate oversight or ensuring the delegated individuals have the necessary competencies could lead to incomplete or inaccurate assessments, thereby compromising client safety and the quality of care. This violates the principle of accountability and the professional's responsibility to ensure competent practice. The professional decision-making process for similar situations should involve a careful consideration of the client's needs, the established professional standards and ethical guidelines, and the potential impact of any proposed efficiency measures on the quality of care. Professionals must advocate for practices that allow for thorough and individualized assessments, even when faced with pressures to increase throughput. This involves clear communication with supervisors or administrators about the importance of comprehensive care and the potential risks associated with shortcuts. It also requires ongoing professional development to stay abreast of best practices and to refine assessment skills to be both effective and efficient. Question 17. Research into the psychological impact of infant feeding choices on new mothers has highlighted a range of emotional responses. A lactation consultant is meeting with a mother who expresses significant distress, stating, "I feel so overwhelmed and inadequate. I'm not sure I can do this breastfeeding thing and I just cry all the time. It feels like a failure." The lactation consultant observes that the mother is withdrawn and has difficulty making eye contact. What is the most appropriate next step for the lactation consultant? Option A. Provide additional education on breastfeeding latch and positioning techniques to boost the mother's confidence. Option B. Suggest the mother take a short break from breastfeeding and consider supplementing with formula to alleviate some pressure. Option C. Recommend a consultation with a mental health professional to assess for postpartum mood disorders and provide appropriate support. Option D. Reassure the mother that these feelings are normal and will likely pass with time and continued breastfeeding efforts. The correct answer is C. Recommend a consultation with a mental health professional to assess for postpartum mood disorders and provide appropriate support. Explanation. This scenario presents a professional challenge due to the sensitive nature of a mother's psychological well-being impacting her breastfeeding journey. A lactation consultant must navigate the delicate balance between providing evidence-based support for breastfeeding and recognizing when a mother's mental health requires a referral to a mental health professional. The core of the challenge lies in accurately assessing the risk to both the mother and infant without overstepping professional boundaries or delaying necessary care. The correct approach represents best professional practice because it prioritizes the mother's overall health and safety, which is intrinsically linked to her ability to breastfeed. By recognizing signs of potential postpartum depression and recommending a consultation with a mental health specialist, the lactation consultant is acting ethically and within their scope of practice. This aligns with the IBLCE ethical guidelines, which emphasize client well-being and the importance of interdisciplinary collaboration when a client's needs extend beyond the consultant's expertise. This proactive referral ensures the mother receives appropriate support, which can, in turn, positively impact her breastfeeding experience and her relationship with her infant. An incorrect approach that involves solely focusing on breastfeeding techniques without addressing the underlying psychological distress is professionally unacceptable. This fails to acknowledge the significant impact of mental health on a mother's capacity to breastfeed and could lead to continued suffering for the mother and potential negative outcomes for the infant. Ethically, this approach neglects the holistic care of the client. Another incorrect approach, such as directly diagnosing postpartum depression without being a qualified mental health professional, is a significant ethical and regulatory failure. Lactation consultants are not trained or licensed to diagnose mental health conditions. This oversteps professional boundaries and could lead to misdiagnosis or inappropriate treatment recommendations, potentially harming the client. A further incorrect approach, such as dismissing the mother's concerns as simply normal adjustment without further exploration, is also professionally problematic. This invalidates the mother's experience and could delay crucial intervention. It demonstrates a lack of sensitivity and a failure to conduct a thorough risk assessment, potentially missing signs of a serious condition. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with active listening and empathetic engagement to understand the mother's concerns. It requires recognizing potential red flags for mental health issues, such as persistent low mood, anxiety, changes in appetite or sleep, feelings of hopelessness, or thoughts of self-harm. If these are present, the lactation consultant should then consider their scope of practice and ethical obligations. The next step involves open and non-judgmental communication with the mother about the observed concerns and the potential benefits of seeking professional mental health support. This should be followed by providing resources and facilitating a referral to appropriate mental health professionals, while continuing to offer breastfeeding support within their expertise. Question 18. The audit findings indicate a lactation consultant provided guidance on introducing complementary foods to a caregiver. Which of the following approaches best reflects current best practice and ethical considerations for this situation? Option A. Assess the infant's developmental readiness for solids, then guide the caregiver on introducing single-ingredient purees one at a time, observing for reactions, and respecting the infant's hunger and fullness cues. Option B. Instruct the caregiver to gently encourage the infant to consume the entire portion of a new food, even if they show signs of fullness, to ensure adequate intake. Option C. Recommend a specific brand of fortified cereal as the first food, as it is a common and easy starting point for most infants. Option D. Advise the caregiver to introduce several new foods simultaneously to quickly determine the infant's preferences. The correct answer is A. Assess the infant's developmental readiness for solids, then guide the caregiver on introducing single-ingredient purees one at a time, observing for reactions, and respecting the infant's hunger and fullness cues. Explanation. Scenario analysis. This scenario presents a common challenge in lactation support where a caregiver's understanding of complementary feeding practices may be influenced by anecdotal advice or outdated information, potentially leading to suboptimal infant nutrition and feeding experiences. The lactation consultant must navigate this situation with sensitivity while upholding evidence-based practices and prioritizing the infant's well-being and developmental readiness. Correct approach analysis. The correct approach involves a comprehensive assessment of the infant's developmental readiness for solids, considering signs such as head control, sitting with support, and interest in food. It then focuses on educating the caregiver about introducing single-ingredient purees, observing for allergic reactions, and respecting the infant's cues for hunger and fullness. This aligns with best practices in infant feeding, emphasizing a gradual, responsive introduction of complementary foods that supports the infant's physiological and developmental needs. This approach is ethically sound as it prioritizes the infant's health and development and is consistent with current evidence-based guidelines for infant nutrition. Incorrect approaches analysis. One incorrect approach involves recommending a specific brand of fortified cereal as the first food without assessing the infant's readiness or considering other single-ingredient options. This is a failure to individualize care and may overlook potential sensitivities or preferences. It also bypasses the crucial step of observing for allergic reactions to new foods. Another incorrect approach is to suggest introducing multiple new foods at once to see what the baby likes. This practice significantly increases the risk of identifying the source of an allergic reaction or intolerance, making it difficult to pinpoint the offending food. It also disregards the recommended practice of introducing foods one at a time. A third incorrect approach is to advise the caregiver to force-feed the infant if they refuse a new food, emphasizing that they need to eat it. This is contrary to responsive feeding principles, which advocate for respecting the infant's cues of satiety and avoiding pressure. Force feeding can create negative associations with food and feeding, potentially leading to long-term feeding difficulties. Professional reasoning. Professionals should approach complementary feeding introductions by first assessing the infant's developmental readiness. This is followed by educating caregivers on evidence-based practices, including the introduction of single-ingredient foods one at a time, observing for reactions, and respecting infant cues. When faced with caregiver misinformation, the professional's role is to provide accurate, evidence-based information in a supportive and non-judgmental manner, empowering the caregiver to make informed decisions that promote the infant's health and well-being. Question 19. Strategic planning requires a lactation consultant to assess a new mother who expresses concerns about her milk supply and a history of postpartum depression. Her partner is present and expresses a desire for the baby to be exclusively breastfed, but seems to be subtly pressuring the mother to just give her a bottle if she's still crying. The infant appears generally content but has had a few fussy periods. What is the most appropriate initial step in the maternal assessment? Option A. Advise the mother to strictly adhere to a feeding schedule and to avoid offering a bottle to prevent nipple confusion, regardless of her perceived milk supply or emotional state. Option B. Conduct a comprehensive psychosocial assessment, including screening for postpartum mood disorders, and explore the mother's perceptions of her milk supply and infant feeding cues, while also acknowledging the partner's input in a supportive manner. Option C. Focus primarily on observing the infant's latch and suck during a feeding session to determine if there are any mechanical issues contributing to perceived low milk supply. Option D. Immediately recommend a schedule for pumping and supplementing with formula to ensure adequate infant intake and alleviate the mother's anxiety. Correct answer is B. Conduct a comprehensive psychosocial assessment, including screening for postpartum mood disorders, and explore the mother's perceptions of her milk supply and infant feeding cues, while also acknowledging the partner's input in a supportive manner. Explanation. Strategic planning requires a thorough maternal assessment to identify potential barriers to successful lactation and to develop individualized support plans. This scenario is professionally challenging because the mother presents with multiple factors that could impact breastfeeding, including a history of postpartum depression, a perceived low milk supply, and a supportive but potentially misinformed partner. A comprehensive assessment must go beyond simply observing the infant's latch. It needs to explore the mother's emotional well-being, her understanding of infant feeding cues, and the family dynamics. The correct approach represents best professional practice because it prioritizes a holistic and client-centered assessment. It involves gathering detailed information about the mother's physical and emotional health, her feeding experiences, and her support system. This approach aligns with the ethical principles of beneficence and non-maleficence, ensuring that the mother receives care that is both helpful and avoids causing harm. It also respects the mother's autonomy by involving her in the decision-making process and tailoring recommendations to her specific needs and circumstances. This thoroughness is crucial for accurate problem identification and effective intervention planning, which are core competencies for lactation consultants. An incorrect approach that focuses solely on the infant's latch without exploring the mother's mental health history or perceived milk supply would be professionally unacceptable. This would fail to address potential underlying issues contributing to the mother's distress and could lead to an incomplete or inaccurate assessment. Such an approach could violate ethical guidelines by not providing comprehensive care and could potentially exacerbate the mother's anxiety about her milk supply, leading to unnecessary supplementation or early cessation of breastfeeding. Another incorrect approach that involves immediately recommending a specific feeding schedule or supplementation regimen without a thorough assessment of the mother's milk production, infant's intake, and emotional state would also be professionally unacceptable. This prescriptive approach disregards the individuality of each breastfeeding dyad and can undermine the mother's confidence. It fails to adhere to best practices that emphasize evidence-based, individualized care and could lead to iatrogenic problems, such as oversupplementation or a decrease in the mother's milk supply due to insufficient milk removal. Professional decision-making process for similar situations should begin with establishing rapport and creating a safe space for the mother to share her concerns. This is followed by a systematic assessment that includes gathering subjective data, mother's history, concerns, feelings, and objective data, infant's weight, feeding observations, physical examination of the mother's breasts. The information gathered is then synthesized to identify the root causes of any difficulties. Finally, collaborative goal setting with the mother leads to the development of a mutually agreed-upon, evidence-based plan of care. Question 20. Which approach would be most appropriate when a client expresses concern about significant breast asymmetry and its potential impact on her milk supply? Option A. Acknowledge the client's observation of asymmetry and suggest that it is a common variation that usually does not affect milk production, without further anatomical detail. Option B. Advise the client that significant asymmetry often indicates an underlying issue that may require medical evaluation, and recommend she consult a physician. Option C. Explain the difference between glandular tissue responsible for milk production and adipose tissue contributing to breast size, reassuring the client that milk supply is primarily determined by glandular tissue, not overall breast volume or symmetry. Option D. Offer to discuss potential cosmetic interventions that could address the breast asymmetry, as this may alleviate her anxiety. The correct answer is C. Explain the difference between glandular tissue responsible for milk production and adipose tissue contributing to breast size, reassuring the client that milk supply is primarily determined by glandular tissue, not overall breast volume or symmetry. Explanation. The scenario presents a common challenge for lactation consultants, a client expressing concerns about breast asymmetry and its potential impact on milk supply. This is professionally challenging because it requires the consultant to integrate anatomical knowledge with client education and reassurance, while respecting the client's body and concerns. Accurate understanding of breast structure is fundamental to providing evidence-based support. The correct approach involves accurately identifying and explaining the anatomical structures of the breast, specifically the glandular tissue responsible for milk production, and the role of adipose tissue in breast size and shape. This approach is best professional practice because it directly addresses the client's underlying concern with factual, anatomical information, empowering her with knowledge. It aligns with ethical guidelines that mandate providing accurate and evidence-based information to clients. By differentiating between fat and glandular tissue, the consultant can reassure the client that breast size does not directly correlate with milk-producing capacity, thus promoting a positive body image and reducing anxiety. An incorrect approach would be to focus solely on the external appearance of the breasts without explaining the underlying anatomy. This fails to educate the client and may inadvertently validate a focus on aesthetics over function, potentially increasing anxiety. It also misses an opportunity to provide evidence-based information about milk production. Another incorrect approach would be to dismiss the client's concerns about asymmetry without providing any anatomical explanation. This can be perceived as dismissive and unsupportive, potentially damaging the therapeutic relationship and leaving the client feeling unheard and anxious. It violates the ethical principle of respecting client autonomy and their right to express concerns. A further incorrect approach would be to offer cosmetic advice or suggest interventions unrelated to lactation support. This oversteps the scope of practice for a lactation consultant and is ethically inappropriate, as it deviates from the primary goal of supporting breastfeeding and lactation. It also fails to address the client's core concern regarding milk supply. The professional decision-making process in such situations should involve active listening to the client's concerns, followed by a clear, evidence-based explanation of relevant anatomy and physiology. The consultant should then tailor this information to address the client's specific worries, offering reassurance and practical strategies if needed, while always maintaining a supportive and non-judgmental demeanor.